and unfortunately, he couldn't make it happen to join us today. It is now my very great pleasure to invite my teacher, Your Excellency, Dr. Darwish Al-Maharbi, to enlighten us with your wisdom.
Thank you so much, Dr. Ayaman. It's such a pleasure to be here. Very delighted to be able to take part in this extremely important inaugural session. And I have no doubt that the evening will conclude with flying colors, having seen the wonderful work that has been done thus far. I'm also delighted to be able to take part and say a few words. I have no doubt in my mind that what you have embarked on is extremely important for Oman. It is timely, it is important, and I think time will prove in the next few years that it is indispensable to the aspiration of the country, to progress into the direction that it has chosen for itself for the 2040. Let me just maybe tell you a very small story that I think is perhaps maybe fits this wonderful evening. It's about this person who goes to one of the hospitals and complains to the doctors that he's feeling pain wherever he touched in his body. So wherever he pressed in his body, he felt this pain. And being baffled, as the doctor was, he of course ordered some investigation to be taken. And one of these investigations was actually an X-ray, to discover later on that his finger is broken. Okay, and that's why he aches everywhere he pressed in his body. And I think this story is extremely important for me, because sometimes while we are trying to make big decisions about things and moving for the future, maybe we aim for the extraordinary, we miss it, we go for the spectacular, we miss the ordinary. Sometimes we aim for glory and we miss the basics. And of course, at the end of the day, what really matters in this whole jigsaw, if you want, of events for now and for the future is this magic word that we use all the time, analysis. I think there's nothing more telling, nothing more pressing, nothing more indispensable to any effort than the analysis itself. I know that the graveyard is full of indispensable people, that's for sure. But I also know that the knowledge that they leave behind is indispensable to us, because sometimes it is irreplaceable thereafter. And what really stays with us is the knowledge. Knowledge itself is not enough, especially nowadays when we are bombarded by different bits and pieces of information in every walks of life. And therefore, we require not only pockets of mind, but we need plenty of pockets of mind in order to sift through this massive numbers and pieces of information. And that's where I see this whole company comes in, is that with this knowledge that we have, the aspiration that we all have, I think we require individuals who not only possess the knowledge, but also understand what to do with it. And for moving to the future, I don't really have any doubt that yourself, and Dr. Saeed and colleagues that will be sharing this experience with you will be rendering not only the company, but also Oman and also society around us, and perhaps humanity in general. I, of course, see a future that is, of course, checkered by so many different things, but of course, has its own beauty since we are building on brains. And I think brains is the magic word that we use all the time. I wish you all the best in your endeavor. I see you and your colleagues, of course, sharing the passion, in the country, joining hands and moving forward together. And at the end of the day, we all aspire to make that ideal decision, for whatever we do in life. We for sure know that idealism will definitely be hit by realism at some stage. And that realism can only be managed by the wonderful aspiration that we have, coupled, of course, and supported by sheer wisdom that we have all the time. We know also that ideal decisions require ideal brains. You have that, inshallah, you have plenty of it. It requires an ideal resources. That also I can see is happening. And third one requires a wonderful environment. And I think Oman is geared with all necessity for the enabling environment that we all have in mind. I wish you all the best. I wish you all the colleagues here and in the UK all the best. Enjoy the evening, and inshallah we'll hear all the good news from now on for the future. Thank you so much.
So thank you, Your Excellency, Dr. Darwish. It's just wisdom, as usual. Thank you so much. And now it is actually the time for a video. It will show you the essence of Databridge.
Hi everyone, here's Adam. Adam is a hard-working staff working in a big hospital in one of the GCC countries. But the situation is getting complicated as costs getting higher and higher. So he thinks he needs to increase the efficiency of HR to help solving the problem. But it is very difficult, so he needs help. In the other part of the world, there's someone, Ilyas. Ilyas, he is a leading researcher with long experience in this field. He's having an idea, but he is from Britain. Joe, he is a health economist and outcome research expert. He's having an idea, but he's from Germany. Actually, Joe and Ilyas can help Adam. What if there is a way for Adam to collaborate with Joe and Ilyas? We are here. Let me tell you who are we, Adam. Actually, we believe that healthcare personnel deserve the best possible solutions. Having a reputable consultancy board who are leaders internationally in the fields of health economics and health financing, public health, epidemiology, biostatistics, healthcare management and leadership. They are ready to offer you help, and they are continuously analyzing the health sector using the magic of scientific research and health economics to help partners to find opportunities to invest, guiding their investments towards maximum benefits for overall population health. We are Databridge. We are bringing innovations to life.
So I hope that you got the message. It's so brief. So let me now actually help you to understand the strategy that Databridge want to or plan to follow in order to empower investments in Oman, especially in health sector. So what Databridge can uniquely offer is nothing but providing the latest in terms of it's like a consultancy board. Actually, Databridge is having consultancy board, including experts in wide range of specialties in health sector from different parts of the world. And we will try actually using research and scientific method to contextualize this knowledge to fit the GCC environments. And then actually we will provide the unique science of health economics, because we can see that it is poorly used in the region. So we will try to implement the latest tools in health economics to find opportunities for investments. So the strategy here is that we do have like a reputable consultancy board. They will try to analyze the market and analyze the health sectors. They will find the best opportunities that will get you the best overall outcome to the population of Oman, and not only Oman, even the GCC countries. We will try to use open data sources, but if there is a need for deep analysis, we will try to collaborate with institutions and health sector to provide more evidence. So then we will try to publish the opportunities through workshops. After this event, there will be like consecutive workshops to analyze or to present the results of the deep analysis that we are continuously doing. Sometimes there will be like a platform attached to the Databridge website. Through that platform, the opportunities will be presented, and if there is any need for deep analysis, upon request, we can provide them. Not only this, actually, we are providing a business plan from the health economist eyes, because it's really different when there is a flavor of health economic science put into the business plan. And not only this, we will try to connect businesses to each other, because we believe that if businesses connected to each other, we will get more outcome for the population. Databridge will try to adopt and sponsor unique projects with the best outcome for our population. So we will prioritize, and we will try to adopt some projects. Actually, we are in the process of adopting 2 projects with a very strong outcome for the whole population, and we will announce them very soon. So here is like fast or quick talk about the strategy. And now I'd like to actually allow me please to introduce Prof. Sabu Badamat. He is Associate Dean of the Faculty of Social Science, a Professor of Demography and Global Health, and founding co-director of the Center for Global Health Population and Policy at the University of Southampton. He will talk about the innovative approaches to the investment activities in health sector in Oman. So Prof. Sabu, the floor is yours. Please unmute yourself. I think you just asked
yes.
him to unmute.
Can you hear me? Can you hear from me? Yeah.
Yeah. Super. Thank you.
Excellent. So can I also share my screen if I may? Oh, you've got the share. You've got the screen. That's perfect. That's perfect. Thank you. First of all, Dr. Ayaman, Dr. Said, thank you for inviting me. And Assalamu alaikum. I think, Oman, let me start by saying that Oman is very, very close to my heart for various reasons. I think for its, always that the vision that the country has in terms of really moving forward peacefully, ensuring solidarity and I think harmony, especially with the neighbors and so on. That's really admirable. And perhaps, I would say that Oman is one of the countries that I would always deem as one of the best examples of a country that should really lead in a steady and sustainable manner. But what an introduction, Dr. Ayaman. I think you're beginning this wonderful journey with the blessings of your teacher, Dr. Darwish Al-Marhabi. I think I was really struck by the wisdom, the words of wisdom that he shared. I think with from idealism to realism and all these efforts. I think first of all, so my sincere appreciation and thanks to Dr. His Excellency Dr. Darwish for sharing his views. But I think we are actually at a very critical point in a milestone in the world history. In terms of whatever is happening, as you know that well, and it could not be any more timely, because whatever we are really observing at this moment, at this point in time, are the critical challenges that will really hinder and disrupt the whole, kind of social progress as we move. But today I'm going to really keep my presentation very short, because I think what we need is these reflections from colleagues, and I think we assimilate those reflections and try to see that, well, what else we can actually do to enhance investment prospects and so on. So I'm going to really give a little bit idea or a little bit of kind of background about different approaches that are required to understand before we start investment, because investment is such a very big word, and one of the things that I always find is that any investment, any product that we, especially health products, what we have seen in the last 3 years has been phenomenal, like in the sense that the technology has evolved so rapidly in the last 3 years, particularly with the COVID. And we have seen that perhaps the digital engagement in health has become more than probably, kind of tripled or quadrupled over the last couple of years. So therefore, we have to also sometimes pause and reflect. So I always think that, well, the best way to reflect is to really analyze the past, because I think if you look at, for instance, the 1970s, what the kind of the country, how this great country Oman was, that I think perhaps the quote from Mr. Yaqub al-Hashim is that, well, in 1975, Mutra was the only area, and Rumi has not even born, and then Muscat, the rest of the Muscat was covered in sand. So that was the situation. In less than 50 years, we've seen social transformation, economic transformation, human transformation, human capital transformation, urbanization, modernization. All these are coming, and to 2030, we actually don't know what to wait for, because we have been confronted with a number of changes. Some of these changes are positive, driving future development of the country. Some of these changes are disruptive, like, for instance, the changes that we have seen over the last 3 years. Can we move to the next slide, please? So what I'm going to really focus is, I'm going to really give you 5 nuggets. You're probably already familiar with these nuggets, but these are sometimes, I believe that they're very important to reflect. So in my own view, I think the future healthcare delivery is going to be complex and challenging, because as our society is becoming increasingly uncertain, fragile, and interdependent. The 3 words, uncertain, fragile, and interdependent, I say these, I think, for various reasons. So, for instance, since the start of this century, so it's actually, we have to remember, since the start of this century, we have seen more wars and conflict than ever before. And you'd be surprised, the last century was 2 big world wars and so on, and lots of conflicts. But the start of the century, the current century, we have seen more wars and conflicts. I mean, despite entities like the United Nations sitting at the nucleus of this planet, trying to really control and trying to really also kind of monitor and support different countries. Since the start of this century, we have seen more pandemics, like, for instance, more emerging infections and re-emerging infections in various forms than ever before. So why are we really, why the start of the century? Is because the start of the century was also a critical turning point for the world population changes, like the dramatic changes in the population. Particularly, I think the current century has been really kind of accompanied by demographic changes that have become quite unprecedented, particularly in Europe. As we know that one side is graying, one world is graying, and with huge burden of non-communicable diseases, and the other side is actually confronted with the double or even triple or quadruple burden of diseases. So we have to really have reflection. So war, conflicts, climate change in its extreme form. I've never seen that, for instance, rain, extreme rain in Muscat during summertime, and that was really quite unprecedented. And not just that, but also, I think if you look at, for instance, at the same time, in same geography, you have, for instance, China under severe drought and Pakistan severely flooding. So what it means is that the implications of these will reach far beyond. I mean, I'm 200% certain that it'll also affect Oman's sort of capacity in terms of, because Oman is a country which is a consuming country which is dependent on food imports from other countries like Thailand, Pakistan, India, and so on. So that interdependency is going to be far more important. Yet we are actually rapidly deglobalizing, it seems. So there are economic shocks that we need to take into account. The war and conflict that we currently see in Ukraine is just a tip of the iceberg. what we are seeing in Syria, for instance, is more than a decade of lockdown. The healthcare systems are not functioning. It's completely fragmented. It's completely kind of some healthcare systems as a whole don't exist at all. So that means like a generation of young people without education, a generation of young people and older adults without healthcare. These are really challenges that we need to really reflect. I mean, I'm sure that we are actually talking about Oman, but in terms of interdependency, it's far wide than we ever think. And there is no doubt, I think we are all epidemiologists, statisticians and demographers. I mean, there is no doubt that there will be more and more of these emerging and re-emerging infections that will really challenge us in the future. That means like we will have to think about technologies that are easily accessible to a wider population. B, it is affordable. That's very important. And C, it must be scalable. If the technology cannot be, if whatever technology, health technology we present cannot be scaled up, then I think there is no point. Finally, it has to also sustain. So sustainability is also very, very critical. Can we move to the next slide, please? So I believe that any investment in healthcare sector must be informed by very strong evidence supported by rigorous analysis and risk mapping. It's not, health economics actually, of course, comes as one of the central kind of focus of all this analysis. But yet, I think when we talk about healthcare expenditure, what we have seen in the last 3 years particularly is an immense kind of an array of efforts, global cooperation of public-private sector partnership, industry partnership, public hospitals really tying up with private hospitals and other healthcare interventions to sort of manage the COVID pandemic and so on. So there's quite a lot of things that are already happening, but they're always sort of response driven, in the sense that we say that don't look for an umbrella, when it is raining. So be ready with the umbrella so that you know how to handle the rain. So the point here is that, well, the technology is all fine, but I think any kind of, I believe that in the future, we will not see many hospitals. I think, well, probably we talk about hospitals being the number of hospitals growing year per year, but that may change, because the dynamics is that we will have a healthcare system within our household, so the healthcare system dynamics that we talk about in terms of the kind of staff resources, the human resources, everything will have to be really focused or oriented towards individuals and people. So can we really move to the next slide? A few slides quickly is that I just wanted to really present some thoughts about the population structures, because quite often I think what we fail to understand is the dynamics of the population, the changes in the composition and size and structure of the population. Because of course, I mean, Oman has got about now around 40% of the population are expatriate population, predominantly males. So when we really plan for any healthcare planning interventions, would need to really take into account these changes in the age structure and the gender composition. Now, these, as you have already seen that, well, there is nationalization that is happening across the GCC countries, but in particularly Oman has already taken that initiative. So we don't know probably how this expatriate population composition will change in the next few years. And they probably have a different healthcare delivery than the citizens. But regardless of that, I think what is important is that any healthcare investment that we are trying to bring in would need to really reflect on these big population changes. Oman is only 40%, but if you look at, for instance, what is happening in Qatar and UAE, about 88% of the population are expatriates. So that means the moment that but one thing to remember is that if you look at, for instance, in the middle, Omani population is a growing population. So it is a growing population. It's relatively young. I mean, there's no doubt about that, because the fertility rate of about 3 children per woman, it is a young population. It's growing, but also the population is significantly at a pace of rapid aging, right? Because I think population aging is something that we tend to ignore sometimes, but each and every household has a person who is 60 years and above. Their healthcare needs, that dynamics is totally different. So the point that I'm making is that we need to really reflect on these very simple age and gender dynamics into that equation. As we move forward, so, you know, for instance, I think, well, you're all familiar with these, the global disease burden, but these are the DALYs, which is the disability adjusted life years. That was actually kind of a measure that was, you know, proposed by Chris Murray and Alan Lopez, two are good friends of mine. I think one is based at the IHME and the other one in Australia. They came up with this framework. It is just for, I mean, it's to sort of, I think it's just a crude form of presenting the healthcare or the disease burden for our understanding. It may not really necessarily reflect the actual DALYs, but it's actually a great start. But if you look at, for instance, the DALYs attributed to disease risks, that means the potential risk of diseases and so on, it's very clear that for all ages, the cardiovascular diseases or the ischemic heart diseases, really that's really on the top. Then we have the hypertensive disorder heart diseases. That's so these are all related to non-communicable diseases and chronic diseases, which are, you know, which have a set of risk factors. We already know diabetes, you know, and various other kind of indicators like cholesterol, hypertension, and so on. But increasingly also we could see that, well, osteoporosis and back pain and other illnesses are also part of it. And there is also something that is probably not very well explored, partly because we don't have the data, is the mental health. Mental health is also something that is really a challenging one, with depression and anxiety. The risks are already in the population, but I think we haven't really seen, what I would say is that we are only seeing probably the tip, not even the tip of the iceberg, because that is something that will, you know, evolve, erupt as populations change. But one thing to also remember is that, well, we all know that, well, as for older people, I think the fevers and falls, I would say that once someone who is really fragile and old, once they fall, then it's, you know, then the real healthcare burden actually start at that point, or the disease burden start at that point for most people. I mean, but some are very healthy. So the falls are also going to be quite an important one. So when we talk about designs, for instance, how do we design future buildings, future infrastructure, we need to really take into account that aspect. So that clearly shows how health is sort of clearly not just a household commodity, but also a multi-sectoral system, because it is connected to various systems. Road injuries, I think, there's no need to talk about it. I think it was His Majesty Sultan Qaboos's, I have had the opportunity to listen to his speech about the importance of reducing the burden of road injuries or traffic injuries. There have been lots of interventions, but I haven't really seen any kind of, although there have been a decline in let's say in road injury related deaths, but it keeps fluctuating. There is no systematic pattern. There is no systematic decrease or a secular decrease in road injuries and deaths, which is again another concern that we should not ignore. There are also neonatal burden, like you have seen that, because of children. I think we know that, there are a lot of AHD related aspects, including congenital abnormalities and autism and so on related. So that area is, it may not really sound really big, but there is actually a challenge there as well. And I was also surprised to see HIV featuring in one of this, but they're probably small contributions, but into the disease burden, but they do exist. Can we move to the next one quickly? So the other aspect is regarding, if you look at the deaths, for instance, the previous ones were the previous slide was all about the DALYs, the disability adjusted life years. So that's actually the years attributed to, years of life lost due to morbidity and mortality. But this one is the deaths. So if you look at that one, it's very, very clear that is the non-communicable diseases, chronic diseases dominate the picture. That's really, stroke and the ischemic heart diseases really dominate. But also increasingly, what we see is a change in the cancer epidemiology. I mean, and that one thing that I think we need more evidence from hospitals is to really understand the reversal in the onset of these diseases. For example, young people as young as late 30s and 40s developing the risk of heart diseases and cancers would need to be really examined very clearly. I don't think that we have enough data to really at the moment to really understand that epidemiology of cancers, but that's going to be one of the challenges. May I also add one other thing is that if at all probably in the next 6 to 8 years, you will hear a breaking news from Southampton. That would be the cancer immunology, because we have really succeeded in the final phase of the trial of cancer, developing a cancer vaccine. So maybe I think that would really again have a significant impact on human life. But Oman's life expectancy now, it's about 78 years, 77, 78 years. This is without any doubt. I think I'm really insisting that, or I'm making it very clear, without any doubt, that we will see another, the life expectancy increasing by at least 5 years within the next 8 years. So that means by 2030, we will have a average life expectancy of the population crossing above 83 and 84 years old. That is going to really bring in lots of challenges, but at the same time, opportunities for us to rethink about how we deliver healthcare. So we move on further. I think I've just given some examples, like the need to really disentangle these by age and gender is very important. So this is actually, if you take, for example, the younger working age population of 15 to 49, this is the pattern that most of the road injuries dominate in the category of risks, the category of injuries and so on. But non-communicable diseases, again, diabetes for young people, particularly also among let's say expatriate population. I don't know how many screening programs are there in Oman that would really periodically screen young people for these chronic conditions. Can we move on further? So the next one is 50 to 69. That is the DALYs. You see that the size or the effect of the contribution of non-communicable diseases, you can see that it's increasing because it's older population. And further, so in the next slide, I think for 70 plus, you can see that it's even bigger. The share is bigger because very clearly, I think towards the end of their life, people's life, I think most of them are really confronted with these diseases, and these diseases also incur, I think sometimes, I don't know whether there is data to really prove that in terms of hospitalization, the number of days spent in hospital. Those are the kind of indicators that we need to start thinking about before we come up with. So one solution here is perhaps, the people don't need to come to hospitals anymore. So I think if we have the right data, if we have the right technical solution, or if we have the right simple intervention, let's say, for instance, if there are mobile clinics that could operate for specifically for elderly population, you don't need to drag them to the hospital. What we see these days, especially in private hospitals, is that older people, 60 plus, are brought to hospitals for small conditions, and they end up staying in ICU and ventilators for a long time. So that is not the kind of healthcare that we want. What we want is actually a healthcare that would really be more, so it has to be looked at from stages. I think that needs to have further reflections. Shall we move on further? So I don't want to take much time because I can go on forever. But these are actually women of reproductive ages, their DALYs. And again, you can see that very clearly gynec problems are actually dominating, like contraception, and what is also quite striking is the years of life lost either due to mortality or morbidity by iron deficiency, for instance, or a lower respiratory infections and so on. So that, I think, again, we need to really have a full understanding. But also here you might have seen that also depression and anxiety taking a little bit, it's more prominent in this particular age group than when compared to other age groups. Can we move further? The third point that I'd like to highlight is the ethics and dignity in healthcare. So we often see that prevention is better than cure, and that is actually since the Alma Ata Declaration in Alma Ata Declaration in 1978. We have been really heavily focused on primary healthcare, and there have been shifts. Now, even the tertiary healthcare systems have really have been divided into 3 or 4 super specialty hospitals and so on. I mean, while these are very important, I think, to save lives, what is also important is to really actually equally invest in the preventative care, and that is, that is part and parcel of healthcare delivery, and not only in terms of in terms of the health expenditure that we are talking about, but also in terms of really making sure that health is the right of every individual. So therefore it is the government's responsibility, or it's actually the community's responsibility, to provide affordable and accessible healthcare, for which what we need is actually a lot of health promotion programs really focused on prevention. And that also, again, that can be segmented by age group and different target groups. For example, young people, their risk behaviors, such as kind of eating processed foods, soda, drinking soda, and so on. I think there are lots of these behavioral changes that we need to really bring in, and therefore prevention is also equally important. Can we move on to the next one, the final one? So the last but one is the research and development. I think that's why we are all here, and which is really extremely important for any before we start sort of thinking of any healthcare investment. We need to really have sufficient time and efforts spent on research. So first of all, I think in this particular cycle, this was actually proposed by the USAID in one of their health strategy document, which I found it very interesting. But first of all, to define a healthcare problem or identify a healthcare problem, you need that synthesis of research evidence. You need a comprehensive analysis. You need data. You need information sharing. You need consultations with stakeholders. So I think, I don't know how many organizations do have stakeholder meetings at the very beginning of the healthcare intervention. So let's say that, for instance, we have come up with a startup, healthcare related startup. Well, consultations do take place, due diligence do take place, but then you need to really have a comprehensive evidence base to support that particular action. Otherwise, what will happen is that it'll be of no use. So defining and identifying that problem is very, very fundamental. So not jumping into any investment, but having a very careful reflection of what is required. That leads to this design of what kind of framework that we need actually to position that problem, or to find solutions to that problem. And that is the point where we also need lots of applied research, and we need monitoring systems. We need to really have systems to systematically monitor and evaluate the outcomes and outputs at various stages. Because I think probably I would say that probably about of all interventions, 90% of the interventions don't work. They fail. We know that. Well, 10% of but there is very little documentation of the underlying processes where, a deeper analysis of which can help us to understand where we have failed, or, what could have really happened. But among those interventions which are successful, like the 10%, they're sometimes very, of those, probably only 5% or 10% get scaled up, and that's how the world works. But I think the reason why those are sometimes never scaled up is not just due to financial reasons, but also because of, I think, there is lack of coherent analysis to really understand that, well, in what circumstances, and like how we can actually implement those interventions, or how we have implemented those interventions, and what are the best practices that we can actually bring out from those interventions, etc. So I think I don't want to spend too much time, but the defining, designing, and developing new ideas is also very important. But the future investment, future healthcare is already taken, I mean, is already begun. I mean, in the sense that everything digitalization is happening. Digital health is actually a priority for many national governments and international stakeholders and agencies and so on. But we will have to really think very carefully. So this is an example of drones being used to actually prevent, to provide first aid for people experiencing heart attacks. You know, what it will have is that the drones will have the camera, it will have, you know, the first aid kind of thing. It will also have a display or a demonstration of what needs to be done. So whoever is tackling that patient who is suffering from heart attack or stroke, there will be clear instructions either through audio or through video, and you know that will support them in actually providing that healthcare. So, but that means, like, you know, well, of course, technology is really going to come forward, and we will have to invest more on these technologies. But at the same time, we have to also think of the context, the social context in which these healthcare technologies can be implemented. So, for instance, digital literacy. So, well, now in the vast majority of the population across the globe are actually using smartphone without understanding without understanding anything about the data, the data privacy, the cyber security, and all those. So we have to really equally invest quite a lot of efforts on that digital literacy and data disclosure and all those kind of things. So these are going to be quite challenging. The last slide is actually all about this. I think that, well, we will have what is known as a metaverse health. That is really going to really be very, very kind of influencing. So in the sense that we have created an environment where, you know, technologies such as artificial intelligence, augmented reality, virtual reality, blockchain technology, all these are really going to come into picture. And that is not in the long future. In the long run, we all will be dead. We know that. But this will happen probably in next year. You never know. Or the year after, we will see an evolution and a revolution of metaverse health, which can actually, you know, prove to be very prominent in terms of giving patients that more of an experiential healthcare, an interactive healthcare, and more immersive healthcare, where, you know, where the doctor, where you know, they would be even take basic measurements and so on. So I think that's where we are heading towards. So I believe that just to really conclude, I think when we talk about healthcare investments, it is still a growing area, because the way in which the changes are happening across the world have been quite unprecedented over the last couple of years. But the technologies will dominate. But at the same time, we researchers have a very important responsibility. I call it just like corporate social responsibility. We have an academic social responsibility to make sure that, you know, that investments are made with wisdom. So that means, like, you know, you don't really end up having technologies and startups produced, I think, for a short run, you know, just for a few years. But we need to really make sure that these are affordable, accessible, scalable, and sustainable. I think I'll stop there. I'm not really always good at virtual interactions. I'm always good at people-to-people interactions. But I hope one day, very soon, I'll be there in Muscat interacting with all of you. Thank you very much.
Thank you, Prof. I'm always admiring your holistic picture. Thank you very much. And now, Dr. Mehdi, very sorry. Now, ladies and gentlemen, allow me to introduce the star of Databridge consultancy, Dr. Mehdi Javanbakh, a leading international health economist and chief executive officer at Optimax Access in the UK. Dr. Mehdi holds a PhD in health economics and has over 15 years of experience in the health technology assessment field. He used to work as a senior scientist at Newcastle University in the UK, as well as evidence review group member for NICE. Dr. Mehdi is ranked amongst the top 5 most cited scientists in the HTA field in the world, with an extensive research background, and has published over 135 papers in peer-reviewed journals. He has an in-depth knowledge of health economics and strong commercial sense. Dr. Mehdi? Dr. Mehdi?
Yes, yeah, can you hear me?
Yes.
Okay, thank you very much, Dr. Ayaman. Good afternoon, everyone. It is a great pleasure to have this chance to present today. And thank you, Dr. Darwish, Dr. Ayaman, and Dr. Sabu for the great presentation. Yes, yeah, I would be very delighted. I was very honored to be in Muscat a few weeks ago, and I will take this chance to really appreciate all the great hospitality. I really enjoyed my time there, and I met great people, and I was very impressed with the wisdom that I saw in the decision makers and all the Ministry of Health authorities, that they respect the science a lot, and I see a great future for Oman, given the wisdom that I can see in the system to rely on the science for making the decisions. So yes, thank you, everyone. Dr. Ayaman, if you could move to the next slide, please. So yes, I will be presenting today about basically some opportunities or the recent opportunities and trends in the investing in the healthcare sector, plus key barriers.
We can't see you.
Sorry?
We can't see you.
Oh, sorry, let me.
Yeah.
Can you see me now?
That's perfect.
Okay, thank you. So yes, and I will be talking also about some barriers that are like the private investor are facing when it comes to investing in the healthcare sector. And I will basically discuss about how health economics could help to overcome these barriers and at the same time identifying some opportunities for investment. So if you could move to the next slide, please. And the next one, please. Yes. So before talking about a spectrum of or wide range of, let's say, private sector compositions, different entities that are involved or could be involved as a private sector in any healthcare system, I like to kind of highlight some of the points that Professor Sabu also mentioned, which some of them may not be necessarily the case at the moment for Oman, but most of them are. So including aging population, so Oman is not really it's not the issue or big problem at the moment in Oman, but it could be in about 20 years. So we need to be prepared for that one as well. So aging population is a problem in many other countries, which has imposing a high burden in terms of the healthcare costs, because majority of the patients who will be hospitalized for over 2 weeks, they are the people over 60 years old, and basically they impose a lot of pressure on the cost of health and social care. Plus the life expectancy of people with chronic disease has been increasing a lot, and people with chronic disease now living longer. So we need to also be prepared how we can basically, can you hear me okay, by the way, Ayaman? I saw that you increased the volume.
Yeah.
Okay, brilliant. Thank you. So yes, the other thing, like I mentioned, is basically people with chronic disease, including diabetes, are growing and they are living longer. And these are very expensive diseases, as you know, and impose a lot of burden on patients, basically, and the population of different countries. The recent advancement and technology advances is also another thing that we will need to consider when it comes to basically talking about any opportunities of investment for the private sector. As mentioned by Professor Sabu and Dr. Darwish and Dr. Ayaman, there has been some recent changes going from more inpatient kind of setting to outpatient. Most of the procedures that were used to be done as inpatient now are becoming more and more like an outpatient and day case with the less invasive technologies and procedures. We are seeing a great kind of advancement in the telemedicine and telehealth, and also remote patient monitoring with all the different types of digital solutions that we see every day that will enable the patients and the healthcare provider to monitor the patients and how they are doing with the the compliance and the drug adherence, how they are doing in terms of managing their condition. And plus post-acute care kind of centers that becoming again more and more popular. Most of the procedures are done in the hospitals, and then the post-acute care centers are acting as a bridge before they for patients to regain their strengths again before and recover from the disease before they will be fully discharged to their homes. And the last is personalized medicine, that probably all of you have heard about it, or precision medicine, which all the decision making for the medical kind of issues are tailored based on the patient's need and patient characteristics, which is becoming more and more complex and adding the complexity to the healthcare system. But at the same time is the way that we should be going, given that we cannot provide one solution for everybody. So if you could go to the next slide, please. If we look at the composition of the private healthcare sector, as you know, it could range from providing healthcare services to financial entities in the healthcare. So if we are basically talking about opportunities for private sector to invest in the healthcare system, we need to have or map out all the potential or categories of services, or let's say ways that they could contribute or partner with the public healthcare system in order to improve this and the sustainability and the quality of the services that are being provided. So when it comes to health service providing, the healthcare provider around the world in the private sector could basically range from primary care centers to hospitals and clinics, elderly and residential care or psychiatric care, and occupational health and diagnostic services, which some of them are already being also implemented in Oman, like many other countries. It's just about which country has, or what is the proportion of private sector in some countries compared to the others. In terms of medical education and training, again, there are hundreds of universities in the private sector that they are offering training, like official programs for medical students, nursing and paramedics, and pharmaceuticals. There is a demand in the low and middle income countries to go to other countries and pay and basically do these kind of trainings and go back to their countries. This is something that is already, it's happening in many countries. Hundreds of universities in the private sector are offering the medical education. Retailers and distributors, again, the pharmacies, drug shops, drug stores, and all the medical device suppliers and distributors, they are working. But this is very important to ensure that for the new investor, if they want to come and enter into this kind of market, like Professor Sabu mentioned, it is very important to understand the right technologies will be imported to the countries or invented or invested on because, when it comes to medical technologies, over 90% of them, they don't have the right evidence, or they don't have the right, let's say, actual benefits to the patients or to the healthcare system. I have been personally working with over thousands of medical devices from North America or different part of the Europe, or sometimes in Asia as well. We talk about at least five different technologies or 5 different companies that they have a product ranging from different, like from small products to very big ones, like from virtual reality to infection preventive, let's say, small caps. And from my experience, over 90%, they don't have enough, let's say, benefits, or they are not either sustainable, or they are not as they are claiming to be. And so it is important that all these things will be evaluated correctly by the right experts before being widely used or imported to, or to be distributed in different healthcare centers in Oman. The other thing is, of course, manufacturing of basically pharmaceutical or medical suppliers. And the last one is financial entities, basically, medical plans, insurer, like health insurance and health management organizations, which is may not be, again, the case for some countries, but in North America, especially in the US, this HMO or health management organization, they get fixed amount of money for a certain population for a certain period of time. And basically they provide all the services that they will need. But these are, like I said, a wide range of, let's say, various activities or roles that private sector could invest and be involved when it comes to providing healthcare services. And health economics, we will discuss in a few minutes how health economics could basically help and inform all the decision-making to basically make investment in any of these activities. If you could move to the next slide, please. So these are just very few well-established and successful commercial healthcare businesses around the world, as you can see, from general hospitals group to specialist hospitals and polyclinics. There are many, many examples of them, like chain hospitals with branches in different countries. Don't forget that, these services, or when it comes to, private sector, they could basically provide these services to the actual population of the country, or for the foreign people as a medical tourism to come, which is, a very big sector in the private, section of the healthcare system in many countries, including UAE, including Turkey. They have over 500,000 medical tourism that they come to those countries each year, with a revenue of over 1.6 billion in Turkey and over 3.2 billion in Emirates, which basically generating a great income for the country, but at the same time, opportunity for employment and improving the healthcare system in an overall. So next slide, please. Yes, when it comes to basically, if you look at the kind of healthcare infrastructure capacity in GCC countries, as you can see, relatively Oman is the country that has more room compared to the other ones for private sector to grow. It is not really negative, when it comes to, because, we appreciate that there is a global, or let's say universal coverage of healthcare in Oman, but, getting the private sector to be involved can basically improve the overall outcomes in many different ways that we can discuss in a separate call, how this could happen. But this is something that, from the statistics and data, we see that there is more room in Oman compared to the other GCC countries for the private sector to be involved. If you could move to the next slide, please. So yes, and the next one, please. When it comes to the barriers, there is a lack of market information in the healthcare sector, because historically not many financial institutions have been investing in the healthcare sector, and there is a limited information about the size of the market. It's about also financing needs and risk and opportunities and trends compared to the other sector of economy, like transportation, like hospitality and, leisure, things like that. And also healthcare sector is a really complex with several interacting parts and highly regulated complexity in reimbursement, which makes all the kind of, even the lack of information much worse, because, for investor, everybody know that, we need to make sure that they will have enough data before making the decision for investing. And that's why it makes it a bit complex. However, there is a solution, and we will discuss in a few minutes how health economics could basically help the investor to overcome all these issues. And also in terms of, the other barriers is fragmented nature of the sector. Although, consolidation and corporatization are expanding the opportunities. However, the private health sector in most emerging markets remains still highly fragmented and dominated by small healthcare businesses, and also lack of a financial transparency, because, in some countries, including Oman, could be also the case as well, because the healthcare system have been funded mainly publicly. So there is limited information about the profitability of the healthcare centers or even hospitals, or cost of producing services, or medical tariffs. Things like that will make things a bit difficult for the decision makers for identifying the best kind of strategies for investment in the private sector. But it's something that we can discuss. So if you could move to the next slide, please. Okay, how could health economics help investors to overcome these barriers and identify opportunities for investment? In the next slide, I will basically discuss the role of health economics, but let's have a close look at the health economics. Health economics is a field of applied science that basically systematically evaluate the health-related problems to identify the optimal solutions for the investor and for the decision maker, so that the limited evidence will be invested and used as efficient as possible. I have been teaching health economics for almost over 15 years now, and I used to teach like as some clinicians as a part of their MPH program. So they were clinicians that they were actually practicing, and they were taking Master of Public Health as well. And I used to get a question why we should be thinking about money when it comes to population health. And I used to tell them that, okay, no healthcare system have all the money and resources to cover all the needs. And at the same time, health economics is not just about money. It's about identifying the optimal interventions as well, because it is about health economics and outcome researchers. And in health economics, we not just look at the cost, but also the effectiveness, but in a very comprehensive way, because most of the clinical trials, most of the clinical studies that are being conducted in the clinical sections, they look at some intermediate outcomes, and we need a techniques or field of science that can synthesize the evidence so that we can create a clear and complete picture of the effectiveness and cost effectiveness of different interventions when it comes to allocating the resource, because we cannot do everything at the same time for treating a certain kind of disease or a certain situation. Therefore, we need to make a decision. Therefore, we need to find the best solutions and best alternative or interventions. And we need the science that to tell us if we want to systematically reduce the risk of making wrong decisions, which has a huge implications on the population health, but at the same time on the healthcare resource as well. And that's why health economics basically play important roles in many countries, including like in the UK, which I have been working with the decision makers, when it comes to adapting new pharmaceutical products or new medical devices. It's about how we can systematically synthesize all the existing evidence for a certain disease and choosing the right products and services that finally can optimize the outcome. Next slide, please. And yes, and through this kind of toolboxes and techniques that are existing in the health economics field, we can uncover market opportunities in the health sector and address investor knowledge gaps to increase the success rate of investment in the health sector. Next slide, please. Okay, so this is my last slide, and I would like to talk about different basically techniques and different things that we have been doing in the last 10 to 15 years to inform not only the decision maker in the public sector, but also the investor in the private sector as well. So with all the techniques and all the basically toolbox that we have in health economics, the first thing that we could do is understanding the market size. So one thing that we always need to do is understanding the eligible population size for a certain condition by analyzing and using the health economics techniques, understanding the current care pathway, using epidemiological data, understanding the proportion of patients who are falling or basically they are eligible for a certain treatment, and also predicting the patient population size over time, given the current care pathway, the effectiveness of current treatments that we are applying, understanding the economic burden of disease so that we can prioritize the different diseases and conditions, and also doing unmet need analysis and horizon scanning to basically ensure about the new technologies and products that are going to come to the market, but at the same time, by looking at the care pathway and the patient populations and all the different types of evidence that are being published to understand what area need to be focused on going forward. Also, the other part is about evaluating the current and future trends in the health, understanding that and the healthcare expenditure, understanding the national health accounts, where the money are spent, feasibility assessment of new technologies and services. This is very important to see whether a new technology, whether it is acceptable for the care providers, whether it is feasible given the current care pathway, given the current situation, and even patients' kind of preference, identifying the technology to the highest potentials. Like I said, in the last 7 years, I have seen thousands of technologies and companies that they claim certain benefits, but in reality, less than 10% of them have enough evidence and data to prove their claims. And this needs to be assessed properly and systematically to ensure that we will be only adapting the technologies that has the highest potential for the population, for the healthcare system as well. And again, when it comes to sustainability, we need to also understand the customers' needs, which includes the patients and the healthcare providers' preference toward new technologies. Whether when it comes to new technology, we need to see and identify the preference of care provider, which aspect of new technology will be basically important for them. There are certain techniques such as discrete choice experiment that we can systematically look at the preference of healthcare providers toward a new, or to see how they think or what are the key aspects of certain new technologies that is important from the healthcare provider perspective. And the same for patients as well. So we have done these studies many times. Imagine, for example, for women with stress urinary incontinence, when it comes to different interventions, we need to understand what are the aspects of the interventions are important for them to ensure the usability of the services when it is provided. Because if you don't do these studies now, you will implement intervention which is not acceptable by the patients or by the care provider. So it is important that we do these studies in advance to ensure that the success of the product that is, or the interventions that are going to be provided would be as high as possible. The other thing that we could do is return on investment estimation and risk assessment. So again, there are certain techniques about understanding the cost of services or cost of implementing a new healthcare center, given the situation, understanding the key drivers, using modeling techniques in terms of predicting the potential bed occupancy rate, or even the flow of the patients, or in now and in the future. These are all modeling techniques that health economics can offer to the investor to have an estimation and to quantify the risk of their investment, to minimize the loss and ensure that they will be having realistic estimates and prediction of the outcome from their investment, and for the public sector as well, to ensure that whatever investment they make, they have a clear understanding of the potential outcome and consequences of that, given the complexity of the healthcare system. We also help with developing business cases. Again, when it comes to, imagine a private sector or private person who wants to enter into let's say, distributing medical devices or selling devices or even manufacturing devices. When it comes to procurement managers in different hospitals that they want to buy those technologies, the value of new technologies need to be communicated correctly. And that's why developing a business case business case by expert who understand the clinical context, but also the potential implications of adapting a new technology on the healthcare provider cost and healthcare provider kind of flow of work and operational gain that they could get. All of this is very important to ensure that the investment would be successful. And like I said, in overall, the health economics field includes a lot of toolbox that can address all these data gaps and ensure that any investment in healthcare sector will have a very positive and optimized outcome for the patients and for the healthcare system. Thank you very much for your attention.
Thank you very much, Dr. Mehdi. Actually, you start realizing that different sciences, applying different sciences is the best guidance for our decision makers and the decision-making process in health, because it will widen the scope and it will ensure the better overall outcome. So now, actually, let me take you into a journey to better understand how health economists or how Databridge looking at the different opportunities available in healthcare. So actually in Databridge, we want to ensure better overall health or better overall outcome for our population. So if we look at the government side, always the government want to ensure that they are providing better or quality healthcare and to ensure access. So they don't want to sacrifice access, but actually it is getting more complex day after day. So they need support. There is actually support coming from the investors or from the private sector, but you know the private sector are profit maximizer. Yes, they can provide help, but most of the time they are looking for profit. But actually, if the government are trying to use the capabilities of private sector, which is competitive, they are very competitive. They want actually to ensure or in a different way, they're actually always attracted by the government sector because the government sector actually covering wider range of population. For example, the healthcare sector actually nowadays in GCC is worth $104 billion in the GCC countries alone. And imagine it was in 2017, just 76%. So within how many few years, there is actually around 6.5% growth. So it is very attractive for the investors. So it is actually assuring for the government, because always they will find help from the private sector. But at the same time, they want actually to ensure that private sector will actually not use this opportunity. That's why there should be lots of regulations. And now we will go to an example, and you will know the whole story. So, for example, we found that most of the opportunities actually fall in the category where there is always variability in terms of types of interventions and patient expectation. For example, let us look at the post-acute care centers. So what do I mean by post-acute care centers? So if somebody is having like acute abdominal pain, rushing to the hospital, and after giving them the primary care, they will the doctor will diagnose the disease, and then the patient will be like an inpatient or staying in the hospital for several days. So that several days that I'm talking about in the hospital, we are calling it post-acute care. So here you can see that it is really very variable in terms of the interventions that we can provide to the patients. And at the same time, there are different or variable patient expectations. So here, actually, the private sector can help a lot. And actually, in Oman alone, it's worth the expenditure of Ministry of Health in just post-acute care is 200 million Omani Riyal, which actually accounting for 23% of the whole budget of Ministry of Health. So imagine now a situation that the government decides that, okay, I will handle all the services of post-acute care to a private sector investor. Investors are very happy because it's actually 200 million. So the government will say, okay, I will give you the 200 million, but I will not increase. It's for the whole population to ensure that you will provide the same quality with the only 200 million. So actually, company A will come and will say to the government, I will provide actually even better quality than you are providing now with the same money. Why they can provide better quality? Because actually they are ready. They are profit maximizer. They are ready to invest in technologies. They are to actually cut the cost and at the same time increase the quality. At the same time, there's company B, which is watching company A. So the company A is making lots of profit here because it's actually a contract through a government. So what the company B is actually they are investing more and more in R&D, in technologies to bring the quality higher and the cost lower. Why they want cost lower? Because the profit margin will be even higher. So that's why they will compete. So next year, company B will come to the government. The government will see that it's actually better quality and even less cost. So that's why the government will take company B next time. So actually this competitive behavior is very healthy for the population, because then the population will gain better quality and the government will ensure that they are accommodate the increasing cost year after year. So it is one example. So the investor here actually will search for the latest technology, the latest solutions. For example, what are the solutions or the tools available? There are lots of available solutions like Internet of Things, virtual reality, cybersecurity, big data, e-learning, 3D printing, robotics, nanotechnologies, and the list is going on and on. So actually, those are the tools available for through the competition to give us better quality and less cost. And then we will go to the model. So the relationship between the government and the investor is actually what we call it the model. So the model of this relationship can be through privatization, taxation-based income, public-private partnership, health insurance, just collaboration, CSR contribution from the investors. So there are different models that actually will shape the relationship between the investor and the government. So it is like just an example how we will tackle the problems, or how we tackle or show you the opportunities in the future in the upcoming workshops. So actually, Databridge nowadays working in several projects. In the pre-visit, we are tackling the pre-visit because actually it is common sense. It is less expensive, and at the same time, it is actually giving a better outcome. But you can ask yourself, actually, we do have lots of interventions here in this part, which is pre-visiting. We don't want patients to come into the hospitals, and we are hearing this since decades. But why we can't see like tangible outcome now? Because after research, I found that most of the interventions, they are lacking the power of science. They are just finding technologies segregated and taking one technologies without guidance that it will help to impact at the population level. For example, I will give you one example. You can see that there are lots of success stories using technologies in guiding the lifestyle of population. You can see that sometimes the population is like dragged in one like direction. For example, using the Instagram, Snapchat, they are really addicted. You can see that people are at the gathering, they are even not talking using them. So why those companies are successful to guide the population into one direction? Because they are using nothing but science. Have you heard about brain nuggets? Brain nuggets are actually, if they are, brain nuggets are simple, like tiny, short informations that the brain will get addicted. And you can see it now that our kids are addicted to YouTube, but not cartoon. Why? Because they are actually addicted to brain nuggets. So if we use science and we know science, it will be very easy for us to use the technologies to guide the lifestyle of our populations. So actually in Databridge, we are using the power of behavioral economics and behavioral science to use the theories that the successful companies are using to guide the population, but we want to guide them into adopting a healthy lifestyle. I hope that it is clear. There are lots of uncover of more details for certain opportunities, and we will ensure that we are using always science, but and nothing but science. So here is a short video about types of services that Databridge are ready to offer to Oman. It is Databridge. So we wrap up the event. I'd like to express my gratitude towards you all who sincerely contributed to this event in order to make it happen. This wouldn't have been possible without the support of each and every one present here, and there are much to be offered by Databridge to the population of Oman, specifically in health sector. I wish you all a pleasant evening and Dumtum Bewid. Thank you.